we received a bunch of questions through our Facebook page and advertisements for this session. And I want to say that I'm very happy that half the questions were about cats, because it's interesting, only 20% of AMC's patients in 2019 were in fact cats. So we know there are pet cats out there, and clearly they know how to use Zoom because they're asking questions tonight. Okay. The first question I think is a really timely question. And that question is, I may get a rescue dog during COVID-19. And I'm going to tell you that lots of people are taking rescue dogs, because I've been on a couple webinars lately about COVID-19, and they've talked about how the shelters have been emptied so that fewer people have to go into the shelters and take care of animals, and therefore fewer people are exposed to other people who might give them the virus, and the shelters are empty in case there's a need to house animals related to people being hospitalized and things. So kudos to anybody who takes a rescue animal during this pandemic. And the question asker wanted to know how she could prepare her home and what she should have on hand for an easy transition for this new dog that she's getting. So the first thing she wants to do is she wants to ask the rescue group a little bit about the dog's personality, what the dog is eating at the shelter, how you can get that food because you don't want to abruptly change the pet's diet, and anything else that the rescue group can tell her about this dog that she's going to take into her home. Dog doesn't need too much, because you have to learn what the dog's personality is in order to get the toys they like, the bed they want, those kinds of things. So I'd start with simple things. You need the food, you need bowls. And on the other hand, some empty Chinese containers would probably be fine for a dog bowl till you find the cute one that you really like. You need a collar and leash, maybe some toys, maybe a nice fleecy blanket for that crate that you need to have as well. Because the crate helps the dog to have a place where they feel safe, because all of a sudden they've gone from somewhere to the shelter and now your house, and they're going to be a little anxious. So they need a safe place, and a crate is good because then your house is safe and the dog feels safe in the crate. If you have a puppy versus a dog, then you really got to puppy-proof the house. And that's a whole process of trying to think like a puppy and put away all those things like shoes and socks and electric cords that puppies are going to chew on. So I hope that this person who has asked to take this pup, or is going to get this rescue dog, has a lot of fun, because I think this is the perfect time for human reasons and animal reasons for shelter dogs to have a good foster home. Ladies, are there questions, or do you want me to do my next question that was submitted?
We did.
We have a couple, yeah.
Yeah. We can start off with the question from Samir. Samir says he's headed to the West Coast and he's traveling with his cat. His cat is 16. It's an easy cat, but Samir's concern is that it's a 9-hour flight door to door from the time he leaves. Should he get some medications to help bide her over, since it's such a long trip and the cat is 16?
So the first question is the cat going in the cabin with Samir, or is the cat going as cargo? Because that matters about medication. Nobody recommends sedating animals that are going as cargo, because that means that we've decreased their ability to respond to a crisis, and decreased their ability to respond to the stress of being put in a crate and then loaded on an airplane and shipped to California. If the cat's going in the cabin and Samir's with the cat and can monitor the cat, then there probably are a variety of different drugs that you can give to the cat. I can't tell you which is the best for this particular cat, but what I can tell you is that the cat needs to go to the veterinarian a couple weeks before this trip, so that the veterinarian can pick what they think is the best medication, and Samir can do a trial run to be sure that the drug calms the cat down a little bit and is neither too much drug or not enough drug, so that the trip goes as well as possible. So this is one of those things where you need pre-planning. The other thing is every airline has their own set of rules about bringing a pet on board. And so you need to check with that airline, be sure that cat has a reservation, be sure you find out what papers the veterinarian needs to sign, and have all those papers squared away on the timeline that the airline wants. A day too soon or a day too late is problematic for the airlines. And I'm sure right now the airlines are even crazier than ever. So plan it out early sooner so you have a good trip to the West Coast.
Great. Sue said thank you.
Oh,
awesome.
Good.
All right. So our next question, which I'm sure we've been talking about a lot lately. So Kathy read about the tigers at the Bronx Zoo who have coronavirus, as well as the cat in Belgium. And she wanted to know what the likelihood of our pets getting infected and what precautions can we take?
So there have been animals infected with the COVID-19 virus in multiple places. So there are dogs in Hong Kong. There are reports out of Wuhan of cats being infected with the virus in Wuhan. What their illness status is, we don't know. Then there's the cat last week in Belgium, and now we have the tigers in the United States. And the answer to Kathy's question is we just don't know right now. We do know that some cats, some dogs, and some tigers, maybe a lion or two as well, seem to be susceptible to this infection. But there are millions of people that have this virus and only a very sparse number of reports of infected pets. So currently the thought is some pets are susceptible. What the infection rate is, nobody really knows right now. And all along in this pandemic, the veterinary experts have been saying, if you are sick, you have to quarantine yourself from all members of the family, and that includes the animal members. And so if you're sick, you go in the bedroom and close the door, and the cat stays out with everyone who's healthy. If you live alone and you're the only person to take care of the cat or dog, then when you handle that animal, you need to wash your hands before, wear a mask when you're handling the animal, wash your hands afterwards. No kissing, no hugging, no sleeping in the bed, and no sharing of food while you're sick. The better solution, however, is today, before you get sick, designate caretakers and make a care plan for your animals so that somebody else is available to step in and take care of the pets so that your pets aren't exposed to this virus. Because if you're sick, you don't need more hassle in your life and to have your pets sick as well. And AMC's website, which is www.amcny.org, has on it information about how to make a care plan for your pet. And Judith, you have a care plan for your pets, right?
I do. I have enlisted actually a first line person and a second line person to be ready to take in either walk dogs or take them in case my husband and I get sick. And one thing I think might be something to do is to actually send some clean leashes or collars to the person you designated so they don't have to worry about touching any items that were in your house.
Good point. So that information is on the website, and when you go to AMC's website, there's a blue banner across the top, and if you click on that, it'll take you all our COVID information on our website, which we spend a lot of time updating because it seems to change every day.
Yeah, and Dr. Hohenhaus, we got as I'm sure everyone can imagine, we got many related questions about COVID and animals, and Another theme is this question that we got in earlier today. Someone asked, can their cat get COVID? The cat is very lethargic, sleeping more than usual, and the owner is worried that her breathing is a little bit labored. She said after reading about the tiger in the Bronx Zoo, she's concerned about her and doesn't know what to do.
So I have to say, it sounds like this cat is not well, but unless the question asker or someone in her household has COVID, the only place that cats are getting COVID is not from other cats, but is from people who are sick and then making their cats sick. So the Bronx Zoo tiger, the tiger caretaker, was apparently infected but not sick. And that is reportedly how the tiger got sick, because the person didn't know they had the virus. So I guess if the question asker is feeling well, they could be an asymptomatic carrier. We don't really know how many people are asymptomatic carriers, but that's a possibility. If somebody in the household is sick and then the cat needs to go to the veterinarian, then you need to tell the veterinarian that someone in the household has COVID-19, because that, I think, is at least should be considered in this case. There are not good reports of cats, what pet cats look like when they are infected. The report out of Wuhan, which looked at about 150 cats, did not describe any signs of illness in those cats. It didn't say they were well either. It just reported the blood tests that were done on those cats to document that they had been exposed to the virus. So we don't have a good handle on what sick cats look like, except for tigers. And although some of my patients are kind of like tigers, they may not exhibit the same sign as the big cats.
Thanks for that. I didn't know that about the zookeeper. So let's see. We have a question from Karen, who has a 3-pound Chihuahua. She has with a small pea-sized lump on her stomach under the skin, which appeared a few weeks ago. It hasn't gotten any bigger and doesn't seem to be bothering her, but she wonders if she should bring her into the AMC for an appointment.
So our doctors here at the Animal Medical Center are triaging cases in advance to try and keep pets home that don't need to come in and see those pets that really do need to come in. This one's a little hard, and it might be worth scheduling a teleconference where we could video with the dog and its little bump and have some sense of how bad or not bad it looks. Is the Chihuahua a girl or a boy, does it say? Because a girl Chihuahua, with the description of the mass, I would worry that it could be a mammary tumor, a breast cancer lesion in a dog. And so that would be something that you might want to address sooner rather than later. The other most common skin tumor that we see in dogs that's malignant is a mast cell tumor. And those are little kind of hairless red bumps on the skin of dogs. And so that would be certainly another consideration in a Chihuahua, would be either mammary tumor or mast cell tumor. Lots of skin bumps in dogs are benign, however. And so probably the mass is going to need to be tested in some way before a decision is made to do any kind of intervention like surgery. But I think the thing to do would be to call and ask for an appointment, and then the doctor staff will triage these appointments to try and determine who really needs to come out and come in to see us right now, or if it can wait a little bit.
The owner is wondering if it could be a symptom of meds. She's a 12-year-old girl and just had her heat.
So after female dogs are in heat, they sometimes will have generalized mammary enlargement because of the hormone surge, but it would not typically be a pea-sized mass. It would be all the mammary glands would be enlarged. So I don't think that's the answer to this question.
Mm-hmm.
Keep in mind that mammary tumors, half of them are benign, half are malignant. So just because I think it might be a mammary tumor based on location doesn't mean that this is really an awful, terrible thing.
Mhm.
Hope that helps.
We were getting questions in really quickly, so we're just going to try and get through as many of them as we can. I'll jump to another one for Dr. Hohenhaus. They say they have a 14-year-old Chihuahua that underwent surgery at AMC in July 2019. They had a pacemaker placed and diagnosed with pulmonary hypertension. She's been on sildenafil since, and she's doing
Sildenafil.
Yep. She's due for her second 6-month evaluation at AMC in April for an echocardiogram. The question is, should she bring her in, or can I wait until New York City is a bit safer?
I just want to add that there have been several questions coming in about when is appropriate to come in and what sort of things are okay to hold off on. So that's in addition to the one that Michelle read. We've had a few other ones about how to balance that.
So I don't remember when, because every time I say 6 months ago, then it's like 2 years ago. But I did write a blog about going to the emergency room. How do you know you should go to the emergency room? And so that would be, if you go to AMC's website and type in emergency room, that blog will come up, and it gives some very specific recommendations for who really needs to come in urgently. Bleeding, can't stand up, difficulty breathing. And what cardiology tells patients about difficulty breathing is that they will, if the pet is breathing more than 40 breaths per minute, that means an in and an out, that is a reason to come to the emergency room. And so for all of you who are out there streaming videos on your laptop or watching reruns on the Me channel, start counting your pet's breathing in and out with looking at your timer on your phone, so that you get really good at knowing what your pet's normal respiratory rate is. Because for this dog with pulmonary hypertension and the pacemaker, it may be that the dog is breathing fine, or it may be that you figure out the dog is breathing faster than it should. I know that last week cardiology had somebody who they thought was heading towards being in heart failure. They did a video consult. Cardiology could count the pet's respiratory rate over the video chat and prescribed medications to help resolve the heart failure that they thought the pet was going into. So they found it very useful to do that. Again, I think anybody out there who's got one of these 6-month or 3-month rechecks that we tend to do at AMC might do well to reach out to their veterinarian at AMC, because we're all fielding tons of emails and phone calls and reviewing records to say, put it off for another month, or you could skip this visit, or let's wait till things are better, or no, we don't think you should wait, kind of thing. So I would say reach out to your doctor and ask them if in fact you think that the pet can wait. And some people I've said yes, and some people I've said no.
Yeah, I think that Dr. Hohenhaus, we're seeing some questions too about guidance on if a pet has shots or rabies vaccines, if they should come in or if they should wait until the situation in the city calms down a little bit.
So the good news is that there's been some very nice guidance about that from our friends north of the border in Ontario. And I've been to a couple of webinars also where this has been addressed by the World Small Animal Veterinary Association. So if you have an adult animal that has been well vaccinated all their life, those vaccines probably don't immediately expire at the 1-year mark. And so those pets can probably wait. If you have a puppy or a kitten that's young, less than 16 weeks of age, those are the ones that are at risk for contracting these pediatric diseases that can result in, as we had last week, a poor puppy that was here for 7 days hospitalized with parvovirus infection. And the analogous disease in kittens is feline panleukopenia. So they really need that one last vaccine 16 weeks or older. And so I had little Bianca in last week because although she was well, she was under-vaccinated. She's only 10 weeks old. And I was really nervous about her because we do see parvovirus in New York City. The other issue is rabies. And so if a puppy has not had a rabies vaccine, I think that from a public health standpoint, rabies vaccine is important. If you've got an adult animal that's a little late on a rabies vaccine, no one thinks that's a huge big deal. And so it's really the puppies and kittens that we're worried about, or some pet who has some unusual lifestyle that makes them exposed to something. And your veterinarian will be able to help you sort through that. Routine, check blood for heartworm. As long as you've been giving that medication every month, all year, just keep giving that medicine. I'm happy to refill it if you can't come in for the test. There's no reason to worry about having that annual heartworm test done right in the middle of a pandemic.
So we had sorry.
No, I just wanted to
great.
say, hope that answers the conglomerate of questions that you guys have out there.
Yeah, I think that answers sort of the range of sort of healthy to monitoring a chronic illness. So that's great. We have a question from Bonnie who wants to know if, first of all, our avian and exotic department is operational at AMC, and also if her bird can get or transmit coronavirus. She has a cockatiel.
So all our services, I believe, are up and running at AMC, although they're running at lower staffing than normal. And so the doctor that's your favorite may not be here, but someone's going to be here to take care of your pets. I don't know. I checked with Dr. Quisenberry before we sat down to talk tonight, and she didn't know anything about birds and COVID, meaning we haven't heard anything, thumbs up or thumbs down. What I do know is there was a paper out of Korea last week. It has not yet undergone peer review, but a lot of these COVID papers are getting released without peer review, just so the information is out there. And in this particular paper, they did take turkeys and ducks, I believe, but it might have been chickens and ducks, sorry. And they tried to infect domestic chickens and domestic ducks to see if they would get the COVID virus by squirting some up their little chicken and duck noses. And they could not identify any evidence of infection in chickens or ducks, neither pigs. In case you happen to have a pet pig, it seems like pigs are resistant to this as well. The problem is that ducks and chickens are not the same as our pet birds, which in general are parrots or in that particular family of birds. So I have to say that I don't know anything about birds, can't find anything about birds other than ducks or chickens. So I think the recommendation for the bird still goes, if you're sick, don't handle the bird. If you must handle the bird, wear a mask, wash your hands, and keep the bird away from you, except to provide care for the bird.
Mm-hmm. Yeah, I think that's such good advice for all interactions with our pets right now. Relatedly, we've gotten several questions about sort of interactions with pets while pet owners and pet parents are out. So specifically, they're asking, is it safe for dogs to interact with one another on the street as long as humans keep 6 feet apart? The owner is concerned that the dog could be a surface for the virus, and doesn't seem like we have any certainty about that.
So the CDC, the American Veterinary Medical Association are all saying they don't really believe that dogs are fomites for this virus. There have been 2 studies, one in the Lancet, one in the New England Journal of Medicine, that have looked at surfaces as fomites. And hard, shiny, slick surfaces like plastic, stainless steel, the virus seems to sit there. for a long time. Now, just because it sits there doesn't mean it can infect you. That's a different question. But it does seem to sit on shiny, hard surfaces a long time. Cardboard and paper, it seems to hang around only for a couple of hours. And dogs are much more porous, like cardboard and paper. And so right now, nobody is saying that the surface of a dog is likely to be a fomite, meaning an object that transmits this virus. This virus is really a person-to-person virus, and you need to cough or sneeze on people when they're less than 6 feet away from you. And that's why the 6 feet away rule is there, is that's where, when you cough or sneeze, that radius is where that virus is going to spread. So I don't think that your dog playing with someone else's dog is likely to cause a problem for your dog. The problem is, and why New York City closed all its dog parks, is because the people couldn't control themselves and they were too close together. So we have no playgrounds and we have no dog parks because we have not a good ability to social distance. There's a great video that was from Mythbusters. It's on YouTube, and it shows why 6 feet matters, because the Mythbusters guy somehow figured out how to cough and sneeze and record where the cough and sneeze was going, and you can see that it's really important to stay 6 feet away from people.
Thanks, that's really helpful, especially now the dogs are going to want to interact more with each other because the dog runs are closed. So Lindsay has a question for you, switching gears a little bit. She has a question about over-the-counter food for cats with early kidney disease. She's wondering about foods that have low phosphorus, medium protein, omega-3s, and low sodium. She's wondering if you have any suggestions, because she's finding it difficult to compare the detailed information on each brand and flavor.
Oh yeah, it's very, very difficult. So one thing is, I looked at the IRIS guidelines for treatment. So the IRIS is the International Renal Interest Society, and that the IRIS people have developed a series of guidelines, one to rank how severe kidney disease is in cats and dogs, and then second, to make recommendations on treatment based on those levels of kidney disease. And when you hit stage 2, so IRIS is 1, 2, 3, and 4, and when veterinarians make a staging system, 1 is always less bad than 4 or 5, or the higher number is always worse disease. So IRIS stage 2, the dietary recommendation is, think about starting to feed a kidney-friendly diet. And a kidney-friendly diet is the diet that Judith just described: low phosphorus, omega-3s, maybe low calcium, maybe a little extra potassium. So, because first of all, cats don't like change. Cats want things to be the same way all the time. And that's why there are cats all over the United States freaking out because their owners are home all day, and the cats are like, you're on my sofa, you're making too much noise, and I just want to sleep, and don't bother me. So cats hate change. Cats hate their diet change more than anything. Some pet food can put new and improved on the label, and the cat won't eat it. So, and then when your cat's kidney disease gets significant, the cat doesn't feel so good. So what do you want when you don't feel good? You want comfort food. You don't want anything to change. You don't want any funky food. So, and then what do we do to the cat? We say, oh, your kidneys are not so good. Let's feed you something new. And the cat says, no way am I going to eat that food. So I actually think now is the time to start feeding one of those prescription kidney foods when you don't need the cat to eat it, because cats never do what you want them to. So right now, you don't really care if the cat eats it. Put a spoon of the new kidney food down, put it on a little plate away from their regular stuff, and get them used to the idea that there might be a different food out there, because those kidney foods are really much better for your cat as the diet, or as the disease advances. So start now. I don't know, probably there is a nutritionist who can wade through those labels on the food and figure out if there is any over-the-counter diet. But in general, we don't recommend over-the-counter diets for pets with kidney disease. We tend to stick with the prescription diets, which have been nutritionist formulated, and the diets have been tested to make sure that they are doing what they said they're going to do.
Can you hear me? Can you hear me?
Who am I listening to?
Lindsay. So my vet felt that Linus was like
Sorry, Lindsay. I'm sorry to interrupt you. We're doing our questions only through the chat.
Okay. Just to basically, I don't have a prescription. She feels it's too early, so I was trying to like give something to prevent it from getting that bad.
Okay.
Yeah. So I just happen to have a different take on the IRIS guidelines, and if I can get a cat to eat prescription food before they really need it, I'm one step ahead of the game. And so I think, you might want to have another discussion with your veterinarian about starting to add some kidney food, not exclusively kidney food, but so your cat will want to eat that food when it really becomes necessary, because it's hard to get cats to change what they eat.
Yeah, definitely. We're getting a follow-up question about, is our dispensary at AMC still fully operational, or would we prefer meds be delivered at this time?
Dispensary is open. We ask that you call ahead for the medication, and then the meds you won't go to the dispensary and get it. There's a line out front that says picking up medications, and you get in that line, and then someone will get your medications from the dispensary and bring them to you. So it's not quite as efficient as being able to walk up to the dispensary and pick up your little white bag with the sticker on it, but it still works. And we can have the medications delivered if you want. Just depends on if you're in the neighborhood, or if it involves a big trip for you somewhere you don't want to go, then I think it's reasonable to have the medications delivered to your house. Oops.
I hope they're going to vote for Justice Kennedy.
Sorry about that.
15 gears of it, Dr. Helm. Another question in, and this person would like to know if congenital blindness or deafness in cats at this point can be remedied. Their cat has had both from about a year old.
So we don't have any, well, I don't know exactly what's wrong with the person asking the question's pet. However, congenital blindness in cats is mostly due to degeneration of the retina. That's the part of the eye that recognizes things and can perceive color and light. And cats do get rod cone disease. Those are the parts of the retina that degenerate and cause cats to lose their vision. And they do lose their vision somewhere about 1 year of age. So I'm kind of guessing that's what this particular cat has. The interesting thing about hearing in cats is it's often white cats. And if you are a white cat and you have blue eyes, and some white cats will have one blue eye, some white cats will have two blue eyes, and you are more likely to be deaf if you are a white cat with two blue eyes, less likely to be deaf if you're a white cat with one blue eye, and then still some white cats with no blue eyes are also deaf. And that is a problem with the hearing mechanism. And if cat was a person, they'd be getting cochlear implants. We don't do that in cats. And actually, blind deaf cats do fine as long as you don't rearrange their environment, because they learn to navigate just like people who are blind do as well. So there's no treatment for that, but the diseases are actually quite interesting from a scientific standpoint. Wish I had a better, not that I had a better answer, it was a good answer, but I wish I had a better treatment for the blind deaf cat.
Mm-hmm. Thanks, Dr. Hohenhaus.
Yeah.
We're also getting some questions, which I think might be helpful for our viewers. People are wondering about how we've changed our protocols and procedures at AMC to ensure the safety of both our team and our patients and clients. Obviously, things have changed a lot, so maybe you can walk everyone through sort of what that process looks like right now.
So no clients are coming in the building unless they are sadly euthanizing their pet. And then we ask only that one person come in with that pet, because if our staff gets sick, not that you want our staff to get sick and not that maybe you know you're sick yet, but if our staff gets sick, then no one's here to help take care of your pet. So we're trying to keep our staff well. And so what happens is if you're coming in for a regular visit, then the lobby people check you in, call your doctor. Someone from the team in the lobby meets the team from your doctor, and the pet comes in and you wait in one of our outdoor heated waiting areas that are now occupying the parking spaces in our parking lot. Or you can leave your pet, go do whatever you need to do or go home, and we'll call you, talk about what we need to do, and then let you know when your pet's ready to go home. Kind of just depends on what the pet needs, how long the doctors need to do what's going on, and also what works for you, because we can keep your pet, no problem. For our handicapped owners or disabled people, they can wait in our lobby downstairs, or if the lobby gets too crowded and we can't social distance, then we move people upstairs to the waiting area. And people that have physical disabilities can bring a person with them to help them navigate through the process of being at AMC. So those people who need support can have it. But if you're able-bodied, we try to limit who comes into the hospital.
And I see we're also getting some questions about parking. There's several parking lots nearby. The tent is immediately below AMC, but there are several parking lots within, I'd say, 2 blocks. So those are all still available for parking right across the street.
Well, and there are some parking spaces downstairs as well. I think I saw a car or two in there. So there's still a speck or two of parking at AMC, and then there are other parking garages in the neighborhood.
Yeah.
Thanks for that. That's helpful to sort of know what to expect if you do have to come in.
Yeah, it looks like we're hosting a wedding rather than a pandemic right now.
I'm glad we could get that set up. I think that was really helpful. Mm-hmm. So we have a couple of questions coming in about more sort of dog walking safety. Should we be washing our dog's feet when they come in? Can this virus be transmitted from the floor? Should other humans be petting our dogs? I addressed that a little bit before with the dog breeding question, but those are some of the ones coming in.
So I think that it's important that you social distance your dog from other people, because there are dogs, not very many, only 2, that have contracted this virus. And the virus was spread to those dogs by people who had COVID-19. So I would not have people petting my dog but me, because I think that is risky right now. I think your dog is fine to hang out with another dog. The problem is that if your dog, you can't go to the dog park anymore, so pretty much all they can do is say like hello on the leash, or I guess you could take them off leash early in Central Park. But then when you need to get your dog back, then everybody gets bunched up trying to get their dogs back on their leash. So you have to think ahead a little bit and maintain your social distancing and not have a great cluster of people having a happy hour in Central Park while their dogs are running around, because then somebody will close Central Park because New Yorkers are misbehaving. You know, the governor has said that maybe this curve is flattening, and we don't want to do anything to make this last any longer than it has to. So stay away from other people. I would say keep your dog on a leash and let it say hi to the neighbor dog. Because no one thinks that dogs are going to transmit this either on their fur or their little feet. There's no recommendation from American Veterinary Medical Association, Center for Disease Control, or World Small Animal Association, or anybody else that you need to wash your pet's feet coming in. You know, certainly if you're washing your pet's feet, then you need to think twice about bringing your shoes back into the apartment. And don't think I haven't thought about that, but I haven't done it. So if you really feel compelled to wash your pet's feet, I think there are a couple of things that can make it easier. First of all, if the wipes you're using to wipe down your counters say don't use on skin and don't use as baby wipes, don't use them on your dog's feet. They got some nasty chemical in it that's probably not good. And what you don't need is a dog with sore feet, because then it won't walk, and then you're going to have to come to the animal medical center. And so let's avoid emergencies that are avoidable right now. There are waterless shampoos for dogs. They come, I happen to like one in the clinic that's like a mousse, and you just spritz it on a paper towel or something, and you can wipe their feet down. There are also waterless shampoos that come in a little spritzer bottle like you use to spritz your shirts before you're going to iron them. That would be fine to wash their feet. A little hard for most New Yorkers to wash the feet with like soap and water in a basin, because where would you put it? You know, outside your apartment door? I don't think the neighbors would like that much. So I think that the reasonable thing to use is some sort of product that is made for dogs. Oh, they also make wipes for dogs. You can order them on any animal website. They're just like the Clorox wipes that we're all using on everything, except they're dog safe. So wipes, waterless shampoo mousse, or waterless shampoo in the spritzer bottle. Those will all be good things to wash feet with. I don't really think there's any evidence that we need to wash feet, but if it makes you feel better, those are the products to use. Mm-hmm. Did that get the whole question they were asking? Okay, good.
Yep, that was great. Thank you.
I just want to jump in to remind everyone, we have about 10 minutes left. We're going to go till 7 p.m. So we have time for a few more questions. And if you do have a question, now is definitely the time to chat it for us. I'm sorry, to chat it to us, because we have about 10 minutes left. So please send in any remaining questions now. And at the moment, I'll go to the list of questions that we've received throughout the day for Dr. Hohenhaus. So here we go. Dr. Hohenhaus, someone's writing in with a 14-year-old British short-hair male cat. The cat's been spraying the wall in the bedroom, unfortunately. He was seen by the vet for a routine checkup with blood work about 2 or 3 months ago, and everything was fine. There were no changes in the home, and his litter box was cleaned daily. He did this for a period of time about a year ago, right before and after they had to put down his sibling sister when she was diagnosed with cancer. So they attributed the spraying back then to that. It stopped for a time, but now he started again. They're cleaning the area that he does this with urine enzyme cleaners, but he still goes back to the same spots. They've also used Fell-Away plugins and pheromone sprays with little success. If it's not a medical problem, since his recent exam and tests were fine, would he benefit from something like Prozac? And I appreciate any suggestions.
So cats are fussy about things, and the cat's 14. So one of the reasons that maybe it's not going in the litter box is it has a little touch of arthritis, and it's hard to get into the litter box. And my sister's cat lived till it was 20 or 21. Hard to remember exactly how old that cat was, but it was very old. And they had to find a much shallower litter box to facilitate that little old geezer of a cat getting into the box because he just couldn't pick up his little arthritic legs to get in. So one question when cats are not using litter boxes, are they able to get into the box? And I said, maybe we need a ramp for a cat. And sure enough, if you Google litter box ramps, they make them. Litter box ramps are made to make it easier for the cat to get into the box. The other thing about cat boxes is cats like big boxes. And in New York, we don't have a lot of room for cat boxes. But a bigger box is always better when it comes to a cat. And when they looked, somebody actually did a study on cat litter box preferences and found that cats liked, those under the bed sweater boxes that you put your sweaters in the summer because you don't have room in your drawers for them. And they're really big. They're like 3 feet long and a couple feet wide. That's what cats want. They fantasize over that as their litter box. So if you have a small litter box, I say get a bigger litter box. If you have a tall-sided litter box, because you're trying to keep that litter in the box and not have it stuck to the bottoms of your feet when you put your socks on in the morning, then you might want to get a shallower litter box or a litter box ramp and see if he needs some help getting into the box or a box that he likes better. I hope that those suggestions are helpful to you and maybe can keep your walls from getting spritzed. I think the other thing I do is put plexiglass on my walls. You can buy it at Home Depot in 3x2 sheets. That way it'd be easier to clean than the paint.
Those are good suggestions. Very practical. So Kathy wanted to know that she said she's seen an increase at her local vet of cats and dogs coming down with digestive issues. Could that have anything to do with the coronavirus, or is it really because they are sensitive to their human companion stress during this pandemic?
So I think a lot of things might be operating. Dogs and cats get GI bugs just like people do. And there'll be some weeks where every client that calls me, the dog has diarrhea, and I say, well, maybe it's a virus. And then 3 days later, the other dog in the household has diarrhea. And then I'm like, I'm sure it was a virus. And we don't have names for all those viruses, just like you have stomach upset sometimes, and it's probably a virus. So because everybody's closed in, it may be that viruses are passing between pets in the household or pets in the neighborhood. I think that pets definitely sense stress in what's going on. Pets are also smart, and I think they're bugging us right now for more treats. So think about if the kids gave the dog an entire thing of bacon strips, because if they did, the dog will have diarrhea. Control those snacks. And I also think that they definitely pick up on the stress of people. So I think there are a lot of things going on right now. The cat in Belgium, which is the only cat that's tested COVID positive that anyone talked about clinical signs in, that cat did have some vomiting and diarrhea. The tigers and lions in the Bronx they were not reported to have digestive signs. So I think we don't know. We just don't know what COVID would look like in dogs and cats. The 2 dogs out of Hong Kong reported with COVID infections were completely well. There was no disease in those animals. So very hard for me to speculate as to what a COVID positive dog or cat would look like other than maybe healthy.
Thanks. I think we probably have time for one more, right, Michelle?
Yeah, I think we have time for one more question.
I think we might look at our pre-submitted questions.
Yeah, I have one right here. Let's see. This is about a cat with IDB. She was diagnosed, and the owner is wondering, are there any other medications that are appropriate other than prednisolone? She's on a small dose, 2.5 milligrams once a day. She's young to have this disease, 7. And the owner is very worried about the continued use of these meds and just wondering, are there any other treatments? That'd be very appreciated.
So One of the things that we always try and do with pets with inflammatory bowel disease is to put them on what we call a limited antigen diet, which like mostly means nothing to anyone. What it means is we're trying to feed those pets a protein source that is not something that occurs in a regular diet. So sometimes these diets are also called novel protein sources. And that's why we get diets with kind of crazy things in them like alligator and kangaroo, because the protein is different than the proteins in chicken or beef or fish. I think this question also says that the only special diet the cat will eat is a diet that has duck and fish in it. And that wouldn't be a diet that, I realize it's what the cat likes. And I've already said tonight that cats don't like change, and this cat doesn't want its diet changed. But feeding a diet that is a different protein may decrease the inflammation in the intestinal tract that ends up causing the diarrhea. So the fish is a really common ingredient in cat food. And so most people would not recommend a diet that contains fish, chicken, beef, lamb, because those are the typical protein sources in cat food. So I'd look for a diet that has something other than that in it. The other thing that could be done is you could feed a hydrolyzed protein. So what that means is that in the process of creating the pet food, the protein is chopped up into little component parts so that it doesn't induce inflammation in the intestine. And that's called a hydrolyzed diet. And there are several hydrolyzed diets that are commercially available. That would be another dietary consideration for the cat. Prednisone or prednisolone is the common treatment for inflammatory bowel disease, and we try and use the lowest dose possible. All drugs have side effects, and so prednisolone the treatment needs to be monitored to make sure the cat's not developing the common problems with prednisolone therapy, which are infections like kidney infections or bladder infections, ringworm, which is a fungal skin infection, and occasionally a cat will develop heart failure on prednisolone as well. So that's why your veterinarian needs to monitor your cat to make sure that we have the cat on the lowest dose possible that's controlling the signs and not causing side effects. There are other drugs that can be used, and that would really be up to your veterinarian to make the decision to use those medications, because they're stronger drugs, potentially have more side effects, and but may have benefit if the prednisone and the diet change are not enough for the cat.
Mm-hmm. Well, thank you so much, Dr. Hohenhaus. That's going to be the last question of the night. And thank you so much to everyone who joined us. We're so grateful to have this amazing community. We appreciate all of your time tonight and all of your questions. And we look forward to seeing you again soon, if not in person, then on the internet. Please feel free to visit our website. It's amcny.org. You can also visit us on social media. Our Facebook is facebook.com/The Animal Medical Center. And on Instagram, it's @AMCNY. So please connect with us so we can keep you posted on pet health information, let you know about our next virtual event and otherwise. So again, thank you all so much, and please be safe and be well.
Bye.
Good night, everyone.
Good night.